I'm going to talk about 5 common medications that may cause erectile dysfunction. What if I told you that the medication sitting in your medicine box or the cabinet right now, the one your doctor prescribed to you, which are healthy according to doctor, could actually be sabotaging your sex life, and you probably have no idea it's happening. I'm Dr. Deepak Gelekar, psychiatrist, sexologist, hypnotherapist and de-addiction specialist practicing for the last 44 years at Akola, Maharashtra. Today I'm going to talk about 5 incredibly common medications that new research shows might be causing erectile dysfunction in millions of men. And here's the shocking part. Number 3 on our list is something that over 100 million Americans take every day. In this video, we will explore why medications cause erectile dysfunction, and I will give you a simple game plan for what to do if you are taking these medications, because you should never have to choose between being healthy and your sex life. Mind well, these medications spoil your sex life and you are not aware of it. So first we have to understand about erection, how erection happens. Erection, penile erection, are a complex biological process. The erection requires good blood flow, balanced hormones and healthy nerves, and of course healthy mind. Any disruption in these systems can affect your performance. Normally, when something arouses you, what you see, what you hear or what you feel, your brain sends signals that relax blood vessels in your penis, allowing about 100 to 200 ml of blood to rush in, get trapped and create an erection. Now I'll tell you how medications interfere. Medications can disrupt this process in 3 major ways. Number 1, they reduce blood flow, like trying to fill a balloon through a kinked garden hose. Number 2, they disturb your nervous system, blocking signals between the brain and the penis. And number 3, they alter hormones like testosterone, reducing sexual desire. And without desire, erection becomes difficult, because some of the medicines, they dampen the brain. What data says about this? Around 60% of men have taken at least one prescription medication in the last 30 days. And 1 in 5 men, that is 20%, take 5 prescription drugs regularly. A major study, and the database of the study, looked at 3,000 men on prescription medicines. They were found to be 80% more likely to experience erectile dysfunction than men not taking any medication. 80%. See the figure. Even after adjusting for factors like education, body weight, diabetes, blood pressure and smoking, this result held true. So it doesn't matter. So they even use a genetic method called a Mendelian randomization analysis, which strengthens the evidence, suggesting these medications may not just be associated with erectile dysfunction. They may actually cause it. Now we are going to see 5 biggest culprits which are causing this. Number 5, atenolol, beta blocker. Atenolol, a beta blocker, is commonly prescribed for high blood pressure and heart protection. But it slows your sympathetic nervous system, lowering blood pressure and heart rate. And unfortunately, it can also make penile blood vessels less able to relax and feel. About 25% of men on beta blockers experience some degree of erectile dysfunction. So whenever erectile dysfunction happens, I call the people and say, atenolol, stop it or change it. Number 4 drug, 5th I said atenolol. Number 4 is simvastatin, cholesterol lowering statin. Statins are among the world's most prescribed drugs. Cholesterol, however, is a building block for testosterone. When cholesterol levels drop too low, testosterone can drop too, causing low libido and erectile dysfunction. So low cholesterol, low testosterone. This effect is rare and usually seen only at high doses. So if you are concerned, check your testosterone levels instead of stopping your statin. Now number 3 is aspirin. Are you surprised? Aspirin, so commonly prescribed. Regular over the counter, people purchase it. Aspirin, millions take it daily. But research suggests chronic aspirin use might reduce nitric oxide, the chemical ignition needed for erections. Don't be panic. Aspirin's heart protective benefits often outweigh the risks. Just talk to your doctor before making any change. So don't stop aspirin at a glance, at a stage immediately. Number 2, atorvastatin. Another statin. Atorvastatin works similarly, lowering cholesterol but also potentially lowering testosterone. Still, managing cholesterol and heart health is vital both for your life and your long-term sexual function. Number 1 is metformin, very commonly prescribed medicine for type 2 diabetes. It's a first line drug for type 2 diabetes. Diabetes itself causes erectile dysfunction in nearly half of all affected men. 50% of diabetics, they are having erectile dysfunction, mind well. And metformin may worsen risk by reducing vitamin B12 absorption, impacting nerve function and possibly lowering testosterone. Never stop metformin abruptly. It can be dangerous or life-threatening. So consult your doctor. But you have to remember the conditions these medications treat. Number 1, high blood pressure, high cholesterol and diabetes. And they are far more dangerous than the medications themselves. Uncontrolled diabetes leads to permanent nerve damage and irreversible erectile dysfunction. Untreated hypertension causes strokes and high cholesterol leads to heart attacks. So these medications are literally saving lives. So what can you do now? Now we'll come to the practical thing. Step 1, talk to your doctor. Be honest about your sexual side effects. There can't be any shame. There are alternatives, for example, ACE inhibitors instead of beta blockers, or different statins with fewer sexual effects. Step number 2, optimize lifestyle, regular exercise, a healthy diet, good sleep and stress management. These are game changers. Managing stress is key. Today's world is stressful, but calming your mind helps your body too. So adjust timing or dose. If no alternative exists, ask your doctor about changing medication timing or dose safely. So step number 4, don't ignore the problem. Erectile dysfunction is often an early sign, the canary in the coal mine. Many men with erectile dysfunction later develop heart disease. So get alarmed if there is erectile dysfunction. Recognizing and addressing it early can literally save your heart and your health. So most men who face erectile dysfunction become deeply motivated to improve their health. So let this be your turning point, a chance to rebuild your body, your confidence, your connection and your mind. I truly hope that this video helps you to take that first step towards a stronger, healthier and happier life.